Good afternoon, everybody, and welcome to the WBCB Network as we are here at Hamilton Park for the Drug Overdose Awareness Night. Here at the park, we're going to have plenty of great speakers as we are going to start with the national anthem, and I am Gus, the bus barber, here with you tonight. As we are going to start with the playing of our national anthem tonight. It's a great night presented by Capital Health, Haldeman Ford Subaru, the Mercer County Prosecutor's Office, Hamilton Township Mayor Jeff Martin, and Hamilton Township Division of Health.
See by the dawn's early light, what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fights o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Thank you so much. We will also have our opening prayer by Pastor Will Kaufman of Grace Community Church of the Nazarene.
Let us pray. Father and Creator of us all, we are here to celebrate a tragedy, but to call on you as the Creator, as the healer. Be with our hearts, be with our abilities, and help us to end this scourge of drug abuse and alcohol abuse. We give you this time and ask for your help in creating a better, healthier situation for our world. Amen and amen.
Thank you so much. We would now like to have Mayor Jeff Martin offer a welcome, followed by Margarita Leahy, Executive Director.
Thank you so much. Thank you for joining us again this year for Hamilton. We've already confirmed next year for Hamilton, and we'll have equally nice weather, no rain and not too hot, and plenty of shade. But it's such an important moment for all of us to gather, to pause and think, and really find solace with each other. For so many of us who have experienced the loss of a loved one, of a good friend, or know somebody who's going through the struggle now. And together we can get past this. Together we can get through this. Together we can overcome anything. And I think that's the message we want to send to each other, and we want to send to all those who couldn't be with us today for their own reasons. I have a proclamation from myself and our town council recognizing today as Drug Overdose Awareness Day. There's far too many whereas clause, so I won't bore us with them, right? But just to put this in perspective, more people die from overdoses than from gun violence and car accidents combined. And when you think about that and the time and effort to make our streets safer, to make our lives safer through reducing gun violence, it is only fitting and proper that we gather here today and make sure that together we can get to a better place, and together we can change that statistic. So I thank all of you for coming out and showing your commitment to this cause, to all of our elected officials and community members, because really together we can overcome it. Thank you very much. Put that there. Thank you.
And now we'll have a welcome from Margarita Leahy. She is our Executive Director at Mercer Council. Margarita.
Welcome, Mercer County community members and supporters, to our annual International Overdose Awareness Day. I'm Margarita Leahy, the Executive Director of Mercer Council, and it's an honor to be with all of you tonight. Your presence here shows that you recognize overdose as a critical public health issue and that you stand in solidarity with those who have lost loved ones to overdose. You are also here to support the dedicated individuals who work tirelessly on prevention and intervention efforts to reduce overdose in our community. Since 2016, Mercer Council, the Prevention Coalition of Mercer County, and the Mercer County Prosecutor's Office have done efforts and have proudly hosted and sponsored this event. I would like to also extend my heartfelt thanks to our event sponsors, Hamilton Township, Stark & Stark, Recovery Advocates, WBCB Radio, the Bronx radio station from Ryder, Footprints to Recovery, and Catholic Charities NJ4S. Your partnership is invaluable in advancing this international campaign. I also want to thank our Assemblyman Varelli and D'Angelo and Assemblywoman Reynolds-Jackson. I watch what you are doing for the Assembly, and I'm very proud of all of you for being our champions. So thank you. I also want to express my appreciation to the Prevention Coalition team. They were magnificent to watch this year. I also want to thank the Mercer Council team that provided support to them. I want to thank the Township Hamilton employees who were wonderful this evening, and the contributing members of the Prosecutor's Office for their hard work and dedication in coordinating this event. This year's international theme is Together We Can. Good job, Mayor. It embodies the strength of our community when we unite in healing, so thank you for joining us in that. Before we start the program, I want to introduce Charlene Phelps, our Director of Advocacy and the Prevention Coalition. This is her first year spearheading this event, and she has quickly become a valuable member of our prevention team. Charlene Phelps.
Thank you, everyone, for coming. I just want to piggyback off of Margarita and thank our volunteers, our vendors, for everything that they've done today and leading up to this. Also, our steering committee, we worked very, very hard on this event, and you know, it's a great event. So thank you for everyone for coming out today. All right, Mr. Frisbee, I love you. Thank you for coming last minute. Okay.
Thank you all so much. And sorry to continue picking on you, Mr. Frisbee, but we have our County Commissioner, Mr. Frisbee, Mr. Sam Frisbee here, and he has a proclamation on behalf of the county. Mr. Frisbee. Thank you so much for being here.
No, thank you for inviting me, and thank you for doing this incredible work. You have a superstar in Char. I actually had both she and her sister work for me in recreation over at the City of Trenton many years ago, coming out of high school. So very proud of what they're doing and how they're giving back to their community. A day like today is truly important. Some of us are old enough to remember that on Saturday mornings there was a cartoon break that used to say, "Knowing is half the battle." And when we understand what overdosing can do and how prevalent it is in our communities, that's half the battle. Understanding where people are and how we can begin to help them. And so I have a joint proclamation from the County Commissioner Board and our Mercer County Executive, Dan Benson. And it reads, whereas International Overdose Awareness Day, observed globally on August 31st, serves to raise awareness about the dangers of overdosing, honor the lives lost due to overdose, and acknowledge the grief experienced by families, friends, and communities worldwide. And whereas the overdose epidemic is a national crisis affecting millions of Americans on a deeply personal level, with countless families having lost children, siblings, parents, and friends to substance misuse and overdose, and each loss serving as a painful reminder of the urgent need for bold action to end this epidemic. And whereas during Overdose Awareness Week, we reaffirm our commitment to combating this public health and safety crisis, honoring the memory of those we have lost, and striving to protect the lives that we can still save. And whereas World Health Organization reports that over 500,000 deaths worldwide are attributed to drug use, with more than 70% related to opioids. And whereas International Overdose Awareness Day offers a critical opportunity to recommit addressing this epidemic by enhancing support for its individuals facing substance abuse disorders and misuse disorders, thereby saving lives. Therefore, be it resolved that the County Executive and the Mercer County Board of Commissioners hereby recognizes August 31st, 2024 as International Overdose Awareness Day in Mercer County. Let me say that as important as this is, what I really love is that how our law enforcement agencies recognize the importance of this. I think it was, yes, you can clap for that. I believe it was probably about 8 years ago when now Assemblyman Varelli was a commissioner, and he brought a Narcan awareness meeting to the Board of Commissioners so that we all learned how to use Narcan and that we all carried Narcan. And the beautiful thing is that as I stood and watched the mayor swear in 9 new officers here in Hamilton this morning, we recognize that every single one of them, just like our prosecutors, just like our sheriff's officers, will be carrying Narcan because they understand the importance of this particular issue. So we thank you guys for recognizing this, and this is for you. Thank you.
Thank you so much. No, pleasant. So, as Mr. Frisbee was mentioning, we have some great law enforcement partners with us today. I just wanted to recognize them. We have the prosecutor's office over here and kind of spread out. We have several chiefs with us in the back. If we could just give them a hand. I would also like to recognize that we have Assemblyman Varelli with us and Assemblywoman Verlina Reynolds-Jackson. Of course, Mayor, we are so grateful that you're here. We also have the commissioner who will be speaking to us later, Caitlin Baston, and then Angelo Onofre. And for those of you who don't know, as of August 1st, he is a retiree. But before that, the law enforcement aspect that Mr. Frisbee mentioned, he was vital in making these connections. Law enforcement and treatment, recovery, addiction, understanding isn't usual. But here in Mercer County, we've had a 9-10 year relationship where we've been able to have a dialogue about some very complicated issues. And in order to recognize that, we are going to have Justine Frank, who is the founder of this event. So let's give her a hand here. And she is going to be presenting an award to Angelo Onofre. Justine.
Thank you.
Love you.
Love you too. Such chivalry. Chivalry is not dead, especially among all our heroes, male and female. I normally speak very extemporaneously, but in respecting of the time that we have today, I have written my thoughts, so bear with me. But before I begin, will you allow me, I've never ever done this before, but from my memories, I cannot believe how amazing the turnout. And I want to capture you like all the rock stars do. So will you all wave to me, and I want you to wave your hands up to heaven, because we're inviting that space down to us right now. Amen. I'm going to carry forward with this incredible honor that has been afforded me for whatever reason. I am but a humble cog in this wheel, and it's wonderful to see Charlene. I have not been actively involved the last few years. I've been dealing with family members and health issues. So I cannot believe the baton has been passed and how magnificent. But I want to say, we cannot buy our way out of this. We can only love our way up and out of this. And if you can keep that in your mind, it's you and me, us and we. Can we all say that together? You and me, us and we. And you'll understand, because I've been asked quite a few questions. And in advance of this event, some people have sent me messages, text messages, and emails and asked me questions about why are we still here? How come we're still here? So let me proceed. The whole reason this event began was because one of the very first events in New Jersey was in Sayreville, and I had been invited by several of our grassroots volunteers that were participating. Thank you. It's my father, my mother, my son, who was 13 years in recovery from heroin addiction, who had also had multiple overdoses but survived. I brought my father, a combat Marine veteran, whom I'd only seen have tears 3 times in my entire life. Not even when my brother and sister were killed did he openly shed tears. And the night we brought him there, he stood at that vigil and he saw a pair of police officers' boots and combat veteran boots. And my father stood there and tears poured down his face. That is why, and he is why, we're here, because he also had a really hard time understanding what his grandson was going through, and he just said, pull yourself up by the bootstraps and just get it done. That shifted everything for him. So I acknowledge my dad, who passed away 2 years ago, but he is here with us in spirit. But he's the reason that we're here. Absolutely. Thank you. It is my great privilege to have been invited today to make a special presentation. At this time, let me reiterate the theme of the Mercer Council on Alcoholism and Drug Abuse and the Prevention Coalition of Mercer County, which is to lead ourselves from grief to hope. This presentation is very much about that because it stems from the actions of a particular profession, often confronted with the grief caused by others' recklessness, but whose pioneering responses blazed new trails in relationships within his law enforcement networks that were previously non-existent. As a person in long-term recovery myself of over 4 decades, yes, I'm very old, kids, but I am proof that sustained recovery is possible. No. And having been a member, this is why what I have to say, the only reason what I have to say up here is important is this, because I am your representative, all of you. I'm just you up here. If you were up here getting to speak, I'm you. I've been the member of several grassroots organizations, City of Angels, New Jersey, Recovery Advocates of America. I was the former chairwoman here, but most especially, I'm a mother of a recovering heroin-addicted son. I found myself uniquely straddled in the multiverse of addiction. Like so many of us here today, as children ourselves, or spouses, parents, partners, family members, co-workers, addicts in recovery, addicts seeking the hope of recovery, parents of children in recovery, community advocates, religious and spiritual members of varying faiths and practices, all of us here represent every imaginable fabric of life. We are all agents of change. We are agents of hope. If I can impart anything from my brief time of experience from these past 9 years that we have had these events, it is that moments matter. Words matter. Showing up matters. Actions matter. Again, I defer to our prosecutor and all the law enforcement organizations who stepped up as a result of his involvement. Their actions are what helped create a powerful shift in the paradigm. The world is increasingly precipiced at a tipping point of good and evil. Evermore the unseen enemy encroaches by attacking our society's most precious commodity, our children, our youth, our family environments, where the most basic nurturing and needs seem eroded by the demands on loved ones to provide. We have no choice but to rely on trusted relationships within our communities to raise and lift our children and each other up while these stressors are brought to bear. What one thing or things can we do in these roles then as enlisted agents of change to empower, to embolden, and to overcome ourselves against the enemy in whatever form it manifests? But in the context of this particular event, specifically substance use disorders. And here is the whole summary of everything. Knowledge is key. Education is access to power. A passionate commitment to bringing forth that learned experience and wisdom is everything. Look around. I mean, really, look around. Look at the vendors. Look at one another. Who else is standing here with us today? Look at all our grassroots orgs. Look to those such as Stacy Ross and Dave DeCamp, whom emerged, yes, they deserve a round of applause. They emerged out of these depths, and they are now leaders and have transformed the work that we do, and they have emerged, and they're now standard bearers. I look at Paul Ressler, who's not with us, but with Topac. His son Corey passed away. Instead of grieving parent, he went into overload action mode, and he's the one, if you truth be told, why we have Narcan involved with law enforcement and the hospitals and every automobile that's involved with law enforcement and first responders. Paul Ressler is the reason he got on that, and he went after the pharmaceutical companies. He made sure that Narcan was going to be available for all of us. He fought tooth and nail for it, and it was a really hard battle. I don't know how many of you know that name, but I have to remember these people because this is the back upon which we stand, and it has to do with the questions that I'm asked, which is, why are we still here? What are we doing? What are you doing? I get asked this. I get hammered with it. So what are you still doing about it? Why isn't more being done? Come on, it's getting worse. Why are we still losing kids? There's no answer in a soundbite, but a million pounding images flash through my mind of all these children we've lost, but all of the thousands of children we've saved. And it all comes to my mind in an instant whenever I'm asked from these years, what have we undergone right here in our backyards? You look again around you right now, look to one another and look upon this podium, for we do indeed have many warriors who have voluntarily thrust themselves into the fire to save our loved ones. Today I've been asked to present a very special recognition to one such individual, our previous Mercer County Prosecutor, Angelo Onofre, whose willingness to place himself in a rather seemingly diametrically opposed stance, just by the nature of the duties he is sworn to uphold, delivered us as advocates in recovery across the thresholds of his breaking new ground with law enforcement. These resources became available because of his vision, his capacities, and not the least of which the power of the office which he held, but all of the innumerable relationships in his network which he brought and shifted the paradigm. It takes time to go up against prevailing thinking and roles drummed into the mindsets of those assigned with tackling the hardest issues of the day. Angelo chose long ago in his life to pursue an education which foreseeably empowered, again, emboldened him to become an agent of change. He brought all of that back to us, to our table, right here in our community, the community of his youth, and he reinvested all of that right here, and we received it, and it's for us. That may seem a long answer to what is being done. Once again, we do this by gathering together and sharing our stories, by appealing to our best and brightest resources in the community, those whom have already determined somewhere in their lives that no matter what, they will continue to step up and slay our modern-day dragons. Because of Angelo's vision and the insights of his office, he became a catalyst of change that we have confidence has established a precedence in this community of law enforcement partnerships, and it must continue. Because of Angelo's examples and leadership, stigmas within law enforcement practices were challenged and doors were flung open. It has trickled down and must continue to be that ripple effect within our other law enforcement agents of change. The chiefs of police, who because of Angelo's persistence were willing to enter the conversation, and in turn those leaders are also able to guide those in their charge with new approaches to dealing with the human beings they encounter. You ask me, What's being done? Here's my answer to all of those who wrote to me in advance of this event. I ask of you to please recognize that you and me and someone like Angelo Onofre are what's being done. The logo on my t-shirt, it's the first incursion of this event. It contains a V for victory, represented in the form of a torch, which shines an eternal light of hope, forever overshadowing the darkness we encounter. This community is indebted to Angelo for opening doors never before available to us in our battle with substance use disorders. Because of his foresight, because of his courage, and his willingness to give us a seat at the table, things have changed. Youth are receiving opportunities for interventions where before incarceration was the only imperative. Tonight, may we take our own personal torches and light or rekindle from our own Angelo Onofre's torch. Like Angelo, let us choose to be the bearer of what's possible through our actions, light up our communities with courage, and most importantly, hope. To my sisters and brothers in the addiction recovery arena and the prevention champions who heard our cry and joined with us, and to all of our community, I present this award to Mercer County Prosecutor Angelo Onofre for being the definition of a trailblazer and a bearer of light into dark places, in behalf of a grateful community.
Can I show it?
Yes.
This is your award. Thank you. Do you want to read it?
Would you please read it? Because my...
This award says, presented to Angelo J. Onofre, in appreciation of your pioneering role and proactive advocacy as a founder of Overdose Awareness Day.
May I give you a hug?
Of course
and I
you
mean
can.
everything I said.
Thank you,
Thank you for saving our lives.
Thank you. Everyone. Oh, thank you.
It's big.
Thank you for this honor and recognition. But before I say anything, first, let's have a round of applause for Mayor Jeff Martin for hosting us again. It's kind of good that we're here because I can walk here. And coming in through the jet is always my way of honoring Mayor Martin with his service in the Air Force. Also, to Commissioner Batson, thank you for being here 2 years in a row. 2 years in a row, perfect weather. So, Commissioner, even once you're out of office, I think you still need to come. So, 9 years ago, Justine and Barb Spreckman came to my office. And they said, we want to hold what was called then International Opioid Overdose Awareness Day. I said, great, that sounds like a great idea. Let's do it. After I looked up what it meant, it really was a great idea. Because at the time, there was a stigma of silence. People were afraid to talk that themselves or a loved one or someone they knew were addicted. And we had to break that stigma. And by coming out in the light of day, everyone together, we acknowledged that it's okay to talk about it. And it's okay to ask for help. The reality is, when I started at the prosecutor's office 27 and a half years ago, it was my job to prosecute addicted people. But over those years, age brought some knowledge and a little bit of wisdom, though my wife would probably argue with you about that. But that reality is simply this. We were never going to arrest or prosecute our way out of addiction, ever. And because of that, we had to give resources. We had to start talking about addiction. We had to get our Narcan into the hands of our police officers. But above all, we had to change the law enforcement culture. And we were able to do that. And today we have with us the president of our Chiefs Association, Rob Garofalo from West Windsor, Chief Tim Grant from College of New Jersey, Chris Longo from Lawrence, Chris Nitty, formerly of Robbinsville, and Chief Ken Dubosky from Hamilton Township, and Chief Al Rhodes from Ewing. This wasn't a hard lift for them. They did it willingly. They understood the need that was there. and they knew that they were also helping to save lives. And when push came to shove, every harebrained idea I had, they backed. From the mailboxes in the police stations, to Narcan in police cars. They were always on board. They were always willing. So the theme, Together We Can, really is very appropriate, because together here in Mercer County, not only can we did. And finally, to my friend Anthony Varelli, Verlina Reynolds-Jackson, Sam Frisbee, every year you're here. Every year, without fail. They are our voices in Trenton. They are advocates for everyone here, and they are all around great people. Thanks, everybody. Thank you.
We know you're still around, and we really appreciate that influence. Before we get to our keynote speaker, thank you so much for pointing out the wonderful chiefs here. I wanted to recognize that Creative Change Counseling was a huge sponsor for us, and you guys probably got lots of great goodies in your tote bag from them. They've been such a great champion, and we just wanted to make sure they got recognized. It kind of went out of print, so we really appreciate them. Thank you, Michelle, and all your wonderful team. We are so lucky to get on the schedule again for Commissioner Caitlin Baston. She has a powerful message. She works really, really hard, and we are so thankful that she can come here and talk about some of the things that she has seen and that she's doing. And thank you so much for being here, Commissioner Baston. Thank you so much.
Thank you. It's so wonderful to be back here again, honestly. It felt like such a privilege to be invited to return after I gave remarks last year. And when I came last year, I had actually just started as the Commissioner of Health in July, and came to do this event in August, and felt like I barely had my sea legs as the Commissioner of Health, honestly. But for those of you who know me, I'm an addiction medicine physician and a family physician, and I had spent the 8 years prior to becoming the Commissioner of Health working in Camden, New Jersey on this issue and fighting this disease on the front lines, you know, as a practitioner and as a leader. And we built what's kind of like a hub and spoke model across the state, and we've been talking about evidence-based models, and it felt like a dream, honestly, to get to work with this administration, with Governor Murphy and First Lady Tammy Murphy in this role, because they were recognizing, you know, not just the leadership and the primary care lens and my maternal child health background, but this. They were recognizing addiction as a key public health priority. And I want you to know that, you know, I'm going to talk a little bit about what feels like a key message to me today and how far we've come. But I'm just so thankful to this administration, and that I can't take lightly right now in this time. And so thankful to the other leaders and elected officials who are here, and the organizations who are here, who are backing this message. And just like was said earlier, taking this from the shadows and into the light, into something that is just, as my chief of staff would say, regular public health stuff, right? This is just the bread and butter. And it should be that way. And we can think about it that way and keep talking about it that way and make it normal. And that will help us get to this next level. That, what are we doing? That's part of what we're doing. So thank you all. As I was thinking about what I was going to speak about tonight, you know, I came here last year and I talked a lot about what I was going to do as the commissioner. I had just gotten into this role, right? That I had goals, that I had dreams, that I was fighting with this alongside this administration to make huge change, that we were going to start. We went from a few, I think 7 harm reduction centers in our state, and what I wanted to see was 1 in every single county, at least 1, right? I had goals of getting medication everywhere. I talked a lot about the science and the reason I talk about harm reduction and medication everywhere. And I know I'm a doctor, right? But when I talk about that, that's because medication, and not just giving somebody medication for a minute to detox them, but keeping somebody on medication treatment decreases the risk that somebody will die by nearly 70%. And that is no joke. That's so much better than most of the heart failure medications and other medications that we prescribe as primary care docs every day. This is a seriously effective medication for opioid use disorder. And we have amazing medications for alcohol, right? And we have amazing harm reduction. And I will talk about how far we've come at the end of this, but as I was racking my brain for, hey, I can come up here and I can talk about this again, and I can talk about the science, what I realized with this theme and with, what do we really need to get this message out there? It's a call to action for unity, as has been talked about. It's a togetherness. But what that means to me is that we as a community are not divided on that message of what saves lives. What I still hear, still to this day, in my own addiction treatment, communities and providers and counselors, I hear messages like, hey, when are you going to get off that medication? It's a crutch. You can do this now. Like, have faith. Have faith. And we talk about this a lot, like, hey, give it up to God, right? You can do this. Have faith. You don't need this. And what is so clear to me, that I'm hoping can be clear to all of us by the end of this is not an either or decision. It's not have faith or have science. Anybody here know the parable of the 3 boats? You know the parable. Anyone else? I was young, I remember, in church when I first heard this, and the pastor was telling the story about a really massive flood that came into a town. And there was a woman who had somehow managed to get out of her house and had climbed all the way up to the roof of her house when that flood was coming into the town. And she was stranded on the roof. And people were coming by, and someone came by in a boat. And they said, hey, come on, I've got you. Get on my boat, I'll save you. Right? And she was like, it's okay. I have faith in God. God will save me. I'm a woman of faith. And they said, okay. And they went, what if that's what you say? And they went along. And then another boat came, a bigger boat. Come on, ma'am, you've got to come. We're getting out of here. Get on the boat. She said, I'm a woman of faith. God will save me. I know God will save me. She will. She stayed on that roof. They said, okay, they tried, they urged, she didn't get on. And then finally another boat came by, a third boat came. They said, ma'am, you've got to come. We're the last one. I don't see anyone else coming through here. It's getting worse. I'm not sure we're going to be able to get another boat through here. Come get on the boat. She said, I am a woman of faith. I have faith. I know God will save me. And that last boat went. And the woman drowned. And she died that day. And then she was in heaven. She was like, God, I had faith. I'm so confused. Why am I here? Why are we talking today? I knew you were going to save me. And God said, I sent you 3 boats. Right? Methadone, buprenorphine, naloxone. We have 3 boats. We have more than 3 boats. We have police officers and EMS and all these people out here saying, this is science. We were given this science. Help me help you. I want to give you this medicine. This will help you not die, right? We were given these boats. And what I see as my job as the Commissioner of Health is to flood New Jersey with an ocean that's going to carry these boats to all of you. And so that is what I see every day. And I have unbelievable faith that the tools that we have that work so well, they work better than so many other medications that are out there, that we can get them into the hands of people. And this is a call to action to say, the next time you're in front of somebody who says, nah, I don't need that medicine, I've got faith. You say, it's not an either or decision, my friend, right? God gave you boats. You can have faith and you can take this medication and you can stay on it. That same faith gave us all the science and medications that we have today. It's why kids can survive when they have diabetes and they take insulin every day. It's why people with high blood pressure or other illnesses can take medications and live long, healthy, prosperous lives with their families and play with their grandkids. And addiction is no different. We have incredible science that can help us get there. So with this faith and with this ocean, this is what we are pledging to do for all of you. So far, as I said, when I came here a year ago, I said, hey, let's get a harm reduction center, at least one in every county. We just approved our 50th harm reduction center in New Jersey. 50 from 7. And those harm reduction centers are so critical, not just because they prevent infections and they keep people healthier and alive and thriving, but they are the open doors and open hearts to this community. They are safe spaces. That builds trust, and that is more than what we can do, more than what I can do usually as a doctor every day, right? I need these people being my front lines and eyes and ears, and the people, the communities that you see around here, they are doing that beautiful work. So we have gotten there. We are in 20 out of 21 counties. I know I still have at least, I believe, a year left here. We've got this, right? The 21st county can come, but we have 50 harm reduction centers. We know also that medication, as I said, is critical, and I talked a little bit about getting that medication in the hands of people, and we know that today we're going to have that unified message that you can have faith and you can have science together, and that people can take things that will help them live. We have a platform, and we have finally finalized the agreement with this platform called the Matters Network, the Matters platform, which is an app that anybody anywhere can use as it rolls out across our state and connect the person in front of them with medication, harm reduction, transportation, a voucher to that medication, anywhere. So it no longer has to be that what they have on the front lines is just the reversal drug. You can actually go right from that to the next step. You can keep getting the treatment. We know that it's more than just that reversal, and it's more than just that open hand. It's getting the medication to the people when they need it, when they're ready for it, the minute they're ready for it, right? Not, oh, I'll get you on the schedule in 3 months and hope you're still alive that day, or that you still want to go that day, right? It's that minute of that day that they need it, and we can do that. In New Jersey, under a past health commissioner, we passed that paramedics could carry buprenorphine and actually give that medication and start that medication after an overdose. And that was a game changer. People are 70% more likely to show up in treatment after that, after having that medication, as opposed to just that reversal drug. And we are expanding that across our state. Governor Murphy signed legislation that now decriminalizes harm reduction supplies beyond just syringes, which means that this prosecutor's job was easier, and that so many other people know that we can keep people safe and alive and healthy with things beyond syringes. But we at the Department of Health are also making sure that people know what they can do and where they can do it and how you can integrate this into general health. We passed guidance earlier this year that hospitals, in just your routine care in a hospital, can do harm reduction and can give syringes as needed. Clinics can do this. And then we're making it as easy as possible to become a harm reduction center if you want to go beyond just those initial harm reduction supplies and test strips. So we are doing the part that we can to flood this state with medication, with harm reduction, with those boats, right? We're getting them out to people. But you all are the people on those front lines talking to folks about those boats that are coming their way. And that is the intersectional message that I want us to have. We are faith and we are science, right? We are open arms. We are there to listen to what people want and need. We are there to meet their needs. And we are there to help guide them to things that can save their lives. And we can do that. It's not an either-or decision. So I want to say, again, a huge thank you to everybody for listening, for coming out of the shadows, for standing beside people, as we say, walking this journey, knowing that it can be a difficult journey, but knowing that there was a quote that one of my very close friends and colleagues said earlier this week. It's from the Talmud. It's from Judaism. And it is that he who saves a single life saves the entire world. And to me, that's so critical, because I know that while I'm looking at the numbers and I'm trying to bend the curve and I'm trying to say every life matters, that doesn't ring as true to me as this, because that one life is that family's entire world. And we know that. And as a doctor and as your commissioner of health, I've got all day for that. So I will never stop this fight. I will save every single one of those entire worlds that I can. Thank you.
Thank you so much, Commissioner. A dear friend of mine used to say, where there's life, there's hope. And I'm so thankful that harm reduction is not a dirty word anymore. And I have to say, I often reflect on loved ones lost, that I wish that they had those methods for them. And I'm sure there are too many empty seats here tonight for people that we love and that we are missing. And I don't want us, I celebrate that harm reduction has become better, that the stigmas are coming down. But one of our main goals with keeping this amazing event going after all the work that's been put into it is because we want to remember that they aren't just numbers. And thank you for remembering that. These are people. These are loved ones. Fathers, brothers, sons, sisters, daughters, cousins. And now it's our time to remember them. And the Pinnacle event, the Candlelight Vigil, will be starting soon. For those of you who didn't see, the circle is set up in the back. We are giving every single one a lighted candle. It's a candle. It's a battery-operated candle. If possible, please let us have those back, because we use them year after year. But this is a special time where you can talk about your loved one, where you can remember them, where we can hear about their smile, their laughter, their silliness, or just to be there. You don't have to say anything. We will encircle you with love. Stacy Ross from Recovery Advocates of America will be helping to make you feel comfortable. We have an inner circle. If you don't want to speak, but you just kind of want to be surrounded, you're welcome to step into the circle. But we will have a bullhorn or a microphone that you can speak about your loved one. And we would like to thank everyone who participated in this special program, but even more so, all of our amazing people. All our recovery, treatment, healthcare, law enforcement, education. Thank you so much. You know, we often hear it takes a village. It still takes a village. But now it's our time to remember and to love and to comfort one another. And please know we're here to support you. And there's no shame. There's no shame here. We just want to remember those that we've lost. So we're welcome to start slowly moving back. Grace Community Church of the Nazarene has our candles for us, and we can start going to the Candlelight Vigil. Thank you so much for being here, and come join us again next year.
an absolute fantastic couple speeches as they're now having candlelight vigil in an absolute spectacular event here every year out at Hamilton Park, the Drug Overdose Awareness Day, August 29th. Mercer County's 9th annual. We've been here every year. Now they have an award. This first initial award went to former prosecutor Angelo Onofre, as they said is now retired. You see him plenty enough on the WBCB Sports Network, but now is retired. He gets the initial award, and vendors still around, still plenty of people walking around. They're going to have the candlelight vigil. And thank you to our sponsors, Capital Health, Haldeman, Ford, Subaru, Mercer County Prosecutor's Office, Hamilton Township Mayor Jeff Martin, and Hamilton Township Division of Health. Still have, a fantastic outing of a lot of people here. Didn't seem like as much as years past, but still a fantastic outing nonetheless. And just so happy that you were able to join us today here on the WBCB network. Thank you to Tyler Hoover behind the camera helping me out. I have been Gus Barber signing off from the Drug Overdose Awareness Day here at Mercer Council's Hamilton Park.